As you enter your 60s, your body begins to change in ways that may not always be immediately apparent. One of the most concerning changes can be a loss of balance. However, did you know that beyond the usual suspects of age and underlying health conditions, there are several surprising factors that can contribute to this? Let's explore the reasons doctors highlight concerning balance issues in individuals over 60 and how we can effectively address these challenges. 1. Muscle weakness. Sarcopenia, the age-related loss of muscle mass, begins subtly around age 30 and becomes more pronounced after 50. This gradual decline in muscle tissue leads to a corresponding decrease in strength and coordination, impacting daily functionality. Weakened muscles make it harder to maintain balance and perform everyday tasks such as walking, climbing stairs, or standing for extended periods. A sedentary lifestyle significantly exacerbates this condition in older adults. Without regular physical activity, muscles atrophy rapidly. Muscles require consistent stimulation to maintain their strength and function. Inactivity deprives them of the necessary stimulus for growth and maintenance. The impact on balance is direct. Muscle weakness significantly compromises the body's ability to maintain equilibrium. Leg, abdominal, and back muscles are crucial for postural stability. As these muscles weaken, older adults struggle to maintain proper posture, increasing their risk of swaying, stumbling, or falling during routine activities. Coordination is also affected. Weakened muscles impair the body's ability to react quickly to changing circumstances or adjust to unexpected situations, e.g., stepping onto a slippery surface or rising from a chair. Insufficient muscle strength to support agile movements elevates the risk of falls. Effective solutions focus on strengthening exercises, particularly for the legs and core. Activities like squats, lunges, and resistance band exercises help rebuild muscle mass and improve strength. A gradual approach, starting with low-intensity exercises and progressively increasing the intensity, minimizes the risk of injury while allowing the body to adapt. This also enhances flexibility, coordination, and overall strength. For older adults, professional guidance is invaluable. A qualified trainer or physical therapist can create a personalized exercise program tailored to individual needs and limitations, further reducing the risk of injury. The benefits of maintaining strong muscles are substantial. Stronger muscles directly reduce the risk of falls by improving balance and stability. This enhanced stability allows older adults to confidently navigate uneven surfaces or maintain their stance during prolonged periods of standing. Furthermore, maintaining muscle strength significantly improves quality of life. Individuals can perform daily tasks independently, such as walking, climbing stairs, or engaging in light physical activities. This independence not only enhances physical health, but also improves mental well-being, reducing anxiety and depression, often associated with decreased mobility. Ultimately, strong muscles contribute to greater independence, allowing older adults to maintain their autonomy and enjoy a higher quality of life. 2. Joint stiffness. Joint stiffness. The underlying causes are multifaceted, stemming primarily from the natural wear and tear of cartilage and synovial fluid, as well as inflammatory processes and the overall effects of aging. As we age, the natural process of senescence significantly impacts the structural integrity of our joints. Cartilage, the protective cushioning between bones, gradually deteriorates over time, leading to a reduction in its shock-absorbing capacity. Concurrently, the production of synovial fluid, the lubricant essential for smooth joint movement, diminishes. This combined reduction in cartilage and synovial fluid leaves joints vulnerable, unprotected, and prone to stiffness. The resulting friction and reduced lubrication contribute to pain, restricted movement, and a significant decrease in joint flexibility. Furthermore, inflammatory conditions, such as rheumatoid arthritis, are a common cause of joint stiffness, particularly among older adults. Inflammation within the joint causes swelling of the surrounding tissues, leading to pain and restricted mobility. This inflammation can severely impact the joint's ability to function normally, resulting in significant stiffness and pain that can interfere with even the simplest daily activities, such as walking, sitting, or standing. The aging process itself plays a crucial role. Over time, all components of the musculoskeletal system, bones, cartilage, ligaments, and muscles, undergo age-related changes. These tissues lose elasticity and flexibility, contributing to joint stiffness. This reduced flexibility and range of motion can lead to difficulties with movement, balance, and the performance of everyday tasks. The cumulative effects of cartilage degradation, synovial fluid reduction, inflammation, and the natural decline in tissue elasticity all contribute to the development and progression of joint stiffness. The impact of stiffness on balance: reduced range of motion. Joint stiffness restricts free movement, diminishing the body's range of motion. Stiffness in the legs, back, or hips makes it challenging for seniors to shift posture or adjust their body to maintain balance, increasing the risk of falls. Slower reaction time. Stiffness impairs the body's ability to react swiftly in necessary situations, such as sudden changes in direction or stepping onto an uneven surface. This can lead to an inability to adjust posture or control movement in time, further increasing the fall risk. Limited mobility. Joint stiffness hinders the performance of basic daily activities like walking, standing, and sitting. These activities are crucial for maintaining bodily stability. Difficulty performing them reduces balance and restricts social and daily life participation. Solutions for improving joint stiffness. Flexible and stretching exercises. Stretching and flexibility exercises such as yoga or tai chi can improve range of motion and reduce stiffness. These exercises enhance joint and muscle flexibility, reducing tension and fatigue. Both yoga and tai chi combine muscle strengthening, balance improvement, and pain reduction. Gentle joint movement. Gentle joint exercises like walking, swimming, or cycling can alleviate stiffness without causing injury. These activities maintain joint flexibility, particularly in major joints like the knees and hips. Weight management. Maintaining a healthy weight is crucial to reduce stress on joints, especially the knees and hips. Excess weight accelerates cartilage wear and tear, hastening joint stiffness. Weight management through diet and exercise minimizes the impact of stiffness. Nutritional supplementation. Nutrients like omega-3 fatty acids, glucosamine, and vitamin D can reduce inflammation and maintain joint health. Omega-3s possess anti-inflammatory properties, potentially alleviating stiffness from arthritis. Glucosamine supports cartilage regeneration, while vitamin D strengthens muscles and supports joint flexibility. Assistive devices. Some seniors may benefit from assistive devices like canes, balance aids, or support belts to maintain balance and reduce joint stress. These devices enhance stability and boost confidence during movement. Benefits of improved joint flexibility. Increased mobility. Improved joint flexibility allows seniors to move more easily in daily life. This not only enhances balance, but also reduces the risk of falls. Reduced pain and discomfort. Reduced stiffness minimizes pain and discomfort, enabling seniors to participate in physical and social activities previously inaccessible. Maintaining independence. Flexible, non-stiff joints allow seniors to perform personal activities independently, enhancing self-reliance and improving quality of life. In conclusion, joint stiffness is a major contributor to balance difficulties in seniors. However, this condition can be improved through consistent flexible exercise, weight management, and supportive joint nutrition. These measures not only reduce pain and stiffness, but also enhance quality of life and minimize the risk of falls. 3. Inner ear issues. Inner ear problems. Causes, effects, and solutions. Natural aging. As we age, the structures within the inner ear can change, impacting balance. The inner ear is crucial not only for hearing, but also for maintaining equilibrium. Specialized cells and organs, such as the semicircular canals and otolith organs, sense body movement and regulate balance. Age-related damage or weakening of these structures compromises balance, increasing the risk of falls. Hearing loss. Age-related hearing loss, presbycusis, diminishes the perception of environmental sounds, including those that help older adults perceive spatial changes. Inability to hear warning sounds increases the difficulty in maintaining balance and responding to hazardous situations. Inner ear fluid imbalance. The inner ear contains fluid essential for maintaining body orientation. Fluid imbalances, as seen in Meniere's disease and inner ear disorder, reduce balance perception, causing dizziness and imbalance. This is common in older adults and can lead to vertigo and instability during movement. Inner ear inflammation or disorders. Infections or other pathologies can affect inner ear function. For example, inner ear inflammation, labyrinthitis, or other disorders can cause dizziness and imbalance, increasing the risk of falls. These disorders can disrupt signals from the inner ear to the brain, making balance maintenance difficult. Impact on balance, dizziness, and imbalance. The inner ear plays a vital role in sensing and maintaining balance. When inner ear function is impaired, accurate signals are not transmitted to the brain, resulting in dizziness and imbalance. Older adults may feel unsteady or unable to stand firmly, especially when rising or changing positions suddenly. Difficulty maintaining balance during movement. With impaired inner ear function, older adults struggle to maintain balance in situations requiring quick reactions, such as stepping over obstacles, walking on uneven surfaces, or changing positions rapidly. This significantly increases the risk of falls, particularly in unstable environments like stairs or slippery surfaces. Difficulty adjusting movement. Loss of spatial movement adjustment is a common sign of inner ear problems. With inaccurate signal processing, older adults may find controlling body movements challenging, making walking or changing positions more difficult. Solutions for improving inner ear function. Inner ear examination and treatment. To detect underlying conditions like Meniere's disease, inner ear inflammation, or other disorders, regular visits to an otolaryngologist are recommended. Timely treatment can improve or reduce dizziness and imbalance symptoms. Balance exercises. Balance exercises such as Tai Chi, yoga, or exercises focused on improving body stability can help maintain better balance. These exercises enhance body coordination and improve responsiveness to spatial changes. Assistive devices. Assistive devices like canes, walkers, or specialized shoes can improve balance and reduce fall risk. These tools provide additional stability and support during movement, boosting confidence while walking. Dietary adjustments. A balanced diet is crucial for maintaining inner ear health. Nutrients like vitamin D, magnesium, and omega-3 fatty acids support inner ear and nervous system health, contributing to balance. Reducing dietary salt can alleviate Meniere's disease symptoms if present. Benefits of improved inner ear function. Reduced dizziness and imbalance. Improved inner ear function leads to less dizziness and better balance. This increases confidence during movement and reduces fall risk. Increased mobility and independence. Good balance allows for greater freedom in daily life. This enables independent performance of household tasks and participation in social activities. Enhancing quality of life. Reduced fall risk. With proper inner ear function and supportive measures, fall risk significantly decreases. This helps prevent serious injuries, particularly fractures or head trauma. In summary, inner ear problems can cause dizziness and imbalance, significantly impacting an older adult's quality of life and independence. Regular checkups, appropriate exercises, assistive devices, and a balanced diet can help mitigate these issues and promote a safer, more active lifestyle. Reduce feelings of body awareness. Causes of reduced body position. Sense, neurological aging. As we age, the nervous system can weaken, diminishing the ability to perceive and process signals from the body regarding limb position in space. Proprioception, the body's awareness of its position without visual input, declines. This makes precise movement perception challenging, increasing the risk of falls and imbalance. Nerve and joint damage. Neuropathies, such as those caused by diabetes, peripheral neuropathy, or joint conditions like arthritis, impact proprioception. Nerves and joints transmit information from muscles and joints to the brain, informing body position awareness. Damage or inflammation disrupts this process, leading to imbalance. Reduced sensory input from physical inactivity. Sedentary lifestyles common in older adults reduce proprioceptive acuity. Lack of physical activity insufficiently stimulates muscles and joints, resulting in proprioceptive decline. Decline in other senses, vision, hearing. Impaired vision or hearing necessitates greater reliance on proprioception for balance. Sensory decline reduces awareness and response to spatial changes, hindering balance maintenance. Impact of reduced body position sense. Impaired balance control. Proprioception is crucial for balance regulation during movement. Its decline makes maintaining stability difficult, especially with posture changes or uneven surfaces. This significantly increases fall risk, particularly on stairs or around minor obstacles. Difficulty in movement coordination. Inaccurate limb position awareness hinders movement coordination. impacting walking, rising from chairs, or sitting down. This can lead to imprecise or uncontrolled movements, causing insecurity. Reduced self-care ability. Reduced proprioception affects daily tasks like dressing, hygiene, and navigating the home. Difficulty perceiving limb position makes these activities challenging, requiring assistance. Solutions to improve body position sense. Enhanced physical activity. Regular exercise improves proprioception. Activities like walking, swimming, yoga, or tai chi maintain flexibility, stimulate proprioceptive senses, and enhance balance. These activities improve interlimb coordination, enhancing spatial awareness. Proprioceptive exercises. Specific exercises strengthen proprioception. Simple exercises include single-leg stances, walking along a straight line, or using equipment designed to enhance proprioceptive feedback. These exercises improve spatial awareness and faster responses to environmental changes. Minimizing hazards. A safe home environment without obstacles or slippery surfaces is crucial for fall prevention. Older adults may need assistance decluttering, using assistive devices like canes, walkers, or non-slip mats for safety. Appropriate nutrition. Nutrients like vitamin D, calcium, and magnesium support musculoskeletal health, aiding proprioception. A balanced diet strengthens muscles and the nervous system, supporting optimal joint and muscle function. Benefits of improved body position sense. Reduced fall risk. Enhanced proprioception improves balance, minimizing falls and related injuries like fractures or head trauma. Increased mobility and independence. Improved proprioception maintains independent mobility and daily task performance. This boosts confidence and quality of life, enabling social and recreational activities. Improved confidence in movement. Better body position awareness enhances confidence and security when moving around. This reduces anxiety when venturing outdoors or engaging in favorite activities. In summary, reduced proprioception is a common age-related issue impacting balance and movement. However, through increased physical activity, proprioceptive exercises, environmental modifications, and proper nutrition, older adults can improve proprioception and reduce fall risk. 5. Changes in vision. Causes of vision changes in older adults. Natural aging of the eyes. As we age, various parts of the eye, including the cornea, lens, and retina, undergo natural changes. These modifications can lead to alterations in visual acuity and various vision problems. Common changes include blurry vision, difficulty seeing in low light, and slower eye adjustment when transitioning between bright and dim light. This is a normal part of the aging process, frequently observed in individuals over 60. Myopia, hyperopia, and astigmatism. Pre-existing vision problems may worsen over time. Myopia, nearsightedness, hyperopia, farsightedness, and astigmatism, irregularly shaped cornea, can develop or become more severe with age. Age-related macular degeneration, AMD. AMD is an age-related condition affecting the macula, the central part of the retina responsible for sharp central vision. It can cause loss of central vision, making it difficult to see details such as reading or recognizing faces. AMD often progresses gradually, but untreated, it can lead to permanent vision impairment. Cataracts. Cataracts are a common cause of blurry vision in older adults. As the eye's lens clouds, light cannot pass through clearly, resulting in blurred vision, particularly in bright light or at night. This is a prevalent condition often treatable through cataract surgery. Glaucoma. Glaucoma encompasses a group of eye diseases that damage the optic nerve, often associated with elevated intraocular pressure. It can lead to peripheral vision loss and, if undetected and untreated, complete blindness. Older adults are at increased risk. Diabetes and other systemic diseases. Diabetes can damage the small blood vessels in the eyes, leading to diabetic retinopathy. These changes can cause blurry vision, bleeding in the eye, or vision loss if left uncontrolled. Other conditions, such as hypertension, can also negatively impact eye health. Impact of vision changes. Difficulties in daily activities. Impaired vision makes everyday tasks challenging, including reading, watching television, recognizing faces, and participating in outdoor activities. This can diminish quality of life, leading to feelings of helplessness and reduced social engagement. Increased risk of falls. Reduced visual acuity makes it harder to perceive the surrounding environment, increasing the risk of accidents, especially falls. The ability to identify obstacles, heights, and distances is compromised, making falls and subsequent injuries more likely. Psychological impact. Poor vision can lead to feelings of loneliness, self-consciousness, and anxiety. Inability to engage in favorite activities or interact with others due to impaired vision can cause isolation, negatively affecting mental and emotional well-being. Driving difficulties. Diminished vision makes safe driving difficult, particularly at night or in low light. This can increase dependence on others for transportation and reduce independence. Solutions for improving vision in older adults. Regular eye exams. Regular eye examinations are crucial for early detection of vision problems such as cataracts, glaucoma, and AMD. Ophthalmologists can monitor and treat vision changes promptly, minimizing the risk of permanent vision loss. Corrective lenses and assistive devices. Properly fitted eyeglasses can improve vision for myopia, hyperopia, or astigmatism. Additionally, anti-glare glasses, blue light filtering lenses, or specialized night driving lenses can enhance vision in various lighting conditions. Cataract surgery. For those with cataracts, cataract surgery is an effective option to restore vision. This procedure is safe and common, helping older adults regain clear vision and improve their quality of life. Management of underlying medical conditions. Conditions like diabetes, hypertension, and cardiovascular disease require careful management to prevent vision impairment. Maintaining a healthy diet, adhering to prescribed medications, and regular health monitoring are crucial for protecting vision. Enhanced lighting and environmental modifications. Adequate and appropriate lighting is essential. Good lighting in bedrooms, kitchens, and living areas helps older adults see objects clearly and reduces the risk of falls. Benefits of improved vision. Increased independence. Improved vision enables older adults to perform daily activities independently, maintaining autonomy and self-reliance. This fosters confidence in engaging in activities such as reading, gardening, or shopping. Reduced risk of falls. Enhanced vision allows for clearer identification of objects and obstacles, minimizing the risk of falls and fall-related injuries. Improved quality of life. Improved vision facilitates social engagement, connecting with family and friends, promoting optimism and happiness. This positively impacts mental and emotional well-being. 6. Vitamin B12 deficiency. Causes of vitamin B12 deficiency in older adults. Reduced vitamin B12 absorption. With age, the body's ability to absorb vitamin B12 from food gradually decreases. Factors such as reduced stomach acid secretion and decreased digestive enzyme efficiency can hinder the release of vitamin B12 from food for absorption. This is particularly common in older adults and can lead to deficiency. Gastrointestinal disorders. Conditions like gastritis, bowel disorders, or other digestive system diseases can impair vitamin B12 absorption. Older adults with these conditions may struggle to absorb sufficient nutrients, including vitamin B12. Medication use. Certain medications such as gastric acid inhibitors, e.g. omeprazole, lansoprazole, or diabetes medications, e.g. metformin, can interfere with vitamin B12 absorption. Long-term use of these medications may result in deficiency. Diet lacking in vitamin B12. Older adults who consume limited animal products like meat, fish, eggs, and dairy may not obtain sufficient vitamin B12. Since vitamin B12 is primarily found in animal products, vegetarians or vegans are at higher risk of deficiency unless they supplement adequately. Other medical conditions. Diseases such as celiac disease, gluten intolerance, and Crohn's disease, inflammatory bowel disease, and damage to intestinal lining, reducing vitamin B12 absorption. Individuals with these conditions may experience deficiency if not properly treated and supplemented. Impact of vitamin B12 deficiency. Fatigue and muscle weakness. Vitamin B12 plays a crucial role in red blood cell production and maintaining nervous system health. A deficiency leads to insufficient red blood cell production, resulting in anemia and fatigue. Older adults may experience weakness, tiredness, and lack of energy, impacting their ability to perform daily activities. Neurological disorders. Vitamin B12 deficiency can affect the nervous system, causing symptoms such as numbness in the extremities, loss of sensation, balance problems, and gait disturbances. These symptoms can worsen with prolonged deficiency, potentially leading to permanent nerve damage. Cognitive impairment. Vitamin B12 is essential for maintaining brain function. Deficiency can cause memory problems, cognitive decline, and psychological disturbances. It may contribute to conditions like dementia, shortness of breath, and rapid heartbeat. Vitamin B12 deficiency-induced anemia results in insufficient oxygen delivery to the body. This can cause shortness of breath, fatigue during exertion, and a rapid heartbeat, especially during physical activity. This can significantly impact daily life and quality of life. Psychological issues. Vitamin B12 deficiency can also cause psychological problems, including depression, anxiety, and mood swings. Studies indicate an increased risk of psychological disorders, particularly in older adults, due to vitamin B12 deficiency. This may be due to its impact on neurotransmitters in the brain. Prevention and treatment of vitamin B12 deficiency. Consuming vitamin B12-rich foods. Vitamin B12 is primarily found in animal products such as meat, fish, eggs, dairy, and dairy products. Older adults should consume these foods to ensure adequate intake. If dietary intake is insufficient or absorption is problematic, supplementation may be necessary. Vitamin B12 supplements. For those unable to absorb vitamin B12 from food due to digestive issues or other factors, supplementation is beneficial. Supplements are available in tablets, chewables, or injections for those with severe absorption disorders. Regular health checkups. Older adults should undergo regular health checkups to monitor their vitamin B12 levels. Doctors can test blood levels and advise on supplementation if needed. This allows for early detection and timely intervention. Treating underlying conditions. Conditions like celiac or Crohn's disease require treatment to improve vitamin B12 absorption. Maintaining good digestive health is crucial for ensuring adequate nutrient absorption. Monitoring medication use. Older adults using gastric acid inhibitors or metformin should have their vitamin B12 levels monitored and adjust their diet or consider supplementation to compensate for potential deficiencies. Benefits of vitamin B12 supplementation. Improved energy and physical health. Vitamin B12 supplementation improves energy levels, reduces fatigue, and enhances overall physical health. Older adults feel healthier and can more easily participate in daily activities. Enhanced neurological and cognitive health. Supplementation maintains nervous system health, reducing symptoms like numbness, loss of sensation, and balance disorders. It also supports brain function, improving memory and cognition. Improved mental health. Vitamin B12 supplementation can alleviate symptoms of depression, anxiety, and mood swings in older adults, promoting a positive outlook and improving quality of life. 7. Potential side effects of the medication. Adverse drug reactions in the elderly. Increased risk of drug interactions. Older adults often take multiple medications concurrently to manage chronic conditions such as hypertension, diabetes, arthritis, and cardiovascular disease. Polypharmacy can lead to drug interactions, reducing medication effectiveness or causing unwanted side effects. These interactions can result in serious adverse events, including hypotension, liver failure, kidney failure, or cardiac arrhythmias. Changes in drug metabolism. As the body ages, drug metabolism and excretion change. The liver and kidneys, the primary organs responsible for drug metabolism and excretion, may function less efficiently in older adults. This increases the potential for drug accumulation, leading to toxicity or serious side effects. Medications commonly affected include sedatives, analgesics, and anticoagulants. Increased drug sensitivity. Older adults may be more sensitive to certain medications due to changes in body composition and physiological systems. This can lead to enhanced drug effects and a higher incidence of adverse reactions. For example, antidepressants and opioid analgesics may cause drowsiness, imbalance, and fainting in older adults. Neurological side effects. Some medications can cause neurological side effects, such as memory loss, numbness, cognitive impairment, delirium, or psychological disturbances. This is particularly common with sedatives, anxiolytics, and antihistamines, as they can affect brain function in older adults. Cardiovascular side effects. Certain medications can cause hypertension, hypotension, or cardiac arrhythmias in older adults. For example, anticoagulants such as warfarin can increase the risk of bleeding, while beta blockers can excessively lower blood pressure, causing dizziness, lightheadedness, and fainting. Commonly prescribed medications with increased risk of side effects in the elderly: sedatives and hypnotics. These medications, used to treat insomnia, anxiety, and other psychological issues, can cause memory loss, fatigue, excessive drowsiness, falls, and balance disorders. Older adults are often more susceptible to these side effects due to reduced drug processing capacity. Analgesics. Opioid analgesics such as morphine and oxycodone can cause drowsiness, imbalance, constipation, and dizziness. These side effects can be exacerbated by long-term use or combination with other medications. Anxiolytics and antidepressants. Medications like benzodiazepines, alprazolam, and diazepam can cause side effects such as delirium, memory impairment, confusion, drowsiness, and reduced reflexes. This increases the risk of accidents, especially during driving or ambulation. Antihistamines. Medications like diphenhydramine, Benadryl, used to treat allergies, can cause dry mouth, imbalance, fatigue, and memory impairment. These side effects are particularly concerning in older adults, as they can increase the risk of falls and reduce the ability to perform daily tasks. Antihypertensives. Medications such as ACE inhibitors, beta blockers, and diuretics can cause excessive hypotension, leading to symptoms such as dizziness, lightheadedness, and fainting. This is especially dangerous for older adults, as they may have difficulty maintaining stable blood pressure. Anticoagulants. Warfarin and other anticoagulants can cause abnormal bleeding, especially if older adults do not carefully manage their diet or use inappropriate supplements. Improper dosage or lack of medical monitoring can lead to serious health problems, including intracranial or gastrointestinal bleeding. Preventing and minimizing adverse drug reactions. Regular medication review. Older adults should have regular medication reviews with their physician to ensure they are using medications appropriately and are not experiencing serious side effects. The physician can adjust dosages or change medications as needed. Discuss potential side effects. Older adults should discuss potential side effects of their medications with their physician. The physician can provide solutions to minimize side effects, such as dosage adjustments, medication substitutions, or combination with other therapies. Continuous health monitoring. Older adults should monitor their health and promptly report any changes in symptoms while taking medication. Unusual reactions can help the physician adjust treatment accordingly. Reduce medication burden. Older adults may need to reduce their medication burden or find ways to incorporate non-pharmacological treatments, such as physical therapy, healthy diet, or exercise to replace or supplement medication use. Adhere to prescribed instructions. To avoid side effects, older adults should take medications exactly as prescribed by their physician and should not change dosages or stop medications without their physician's instruction. 8. Chronic illnesses. Chronic diseases are long-lasting conditions that cannot be completely cured, typically developing gradually over time. In older adults, the presence of chronic illnesses is almost inevitable due to the natural aging process and the influence of environmental factors, genetics, and lifestyle. These conditions can significantly impact the health and quality of life of seniors, particularly when poorly managed. Common chronic diseases in older adults include cardiovascular diseases such as hypertension, coronary artery disease, heart failure, and arrhythmias, which can lead to serious complications like stroke, heart attack, and further heart failure, significantly impacting mobility and daily life. Diabetes, especially type 2, is another prevalent chronic disease, with uncontrolled blood sugar levels causing vascular damage, kidney failure, blindness, and neurological problems. It also reduces mobility and increases the risk of cardiovascular disease and infections. Arthritis, rheumatoid and osteoarthritis causes joint pain, stiffness, and limited mobility, hindering daily activities. Chronic lung diseases like asthma and COPD make breathing difficult and limit physical activity, often stemming from smoking, air pollution, or exposure to toxins. Chronic kidney disease involves a gradual decline in kidney function, potentially leading to toxin buildup, hypertension, and electrolyte imbalances. High cholesterol and lipid disorders increase the risk of cardiovascular disease, with older adults often experiencing high LDL, bad cholesterol, and low HDL, good cholesterol. Finally, psychological disorders such as depression, anxiety, and dementia, like Alzheimer's disease, can significantly affect quality of life The impact of chronic diseases on older adults includes reduced mobility and independence, diminished quality of life due to pain, fatigue, and physical limitations, increased mortality risk from uncontrolled conditions and their complications, and substantial financial burdens from ongoing medical expenses. Managing chronic diseases in older adults involves consistent medication adherence as prescribed, regular monitoring of vital signs, blood pressure, blood sugar, cholesterol, a healthy balanced diet, regular age-appropriate exercise, walking, yoga, swimming, and psychological support to cope with stress, anxiety, and depression. Support groups and counseling can be invaluable. In conclusion, proactive management of chronic diseases is crucial for maintaining the health and well-being of older adults. 9. Dehydration. Dehydration in the elderly is a serious concern, stemming from several interconnected factors. Reduced thirst sensation is a common issue. As we age, our bodies become less sensitive to thirst cues, leading to inadequate fluid intake. Changes in kidney function also play a significant role. Age-related decline in renal function impairs the body's ability to regulate fluid and electrolyte balance, making dehydration more likely, especially during hot weather or illness. Underlying health conditions such as diabetes, cardiovascular disease, kidney disease, and gastrointestinal issues, diarrhea, vomiting, significantly increase dehydration risk due to increased fluid loss. Medications, particularly diuretics, but also antidepressants and some blood pressure medications, can contribute to dehydration as a side effect. Poor dietary habits, including insufficient fluid intake and a lack of water-rich foods like fruits and vegetables, exacerbate the problem. Finally, environmental factors, such as hot and humid climates, increase the risk of dehydration, especially if fluid intake isn't adequately adjusted. Symptoms of dehydration in the elderly can be subtle and easily overlooked, often mistaken for other health problems. Common signs include dry mouth and lips, persistent thirst, fatigue, weakness, dizziness, lightheadedness, decreased or absent urination, dry and wrinkled skin, and cognitive impairment, confusion, disorientation. Severe dehydration can also lead to increased heart rate and low blood pressure. The consequences of dehydration in older adults are far-reaching. It increases the risk of kidney dysfunction, potentially leading to acute kidney injury or worsening chronic kidney disease. Dehydration impairs coordination and balance, increasing the risk of falls and fractures. Cognitive function suffers, potentially causing confusion or short-term memory loss, sometimes mistaken for dementia or Alzheimer's disease. The immune system is weakened, increasing susceptibility to infections, particularly urinary tract infections. Finally, severe dehydration can lead to heat stroke, a life-threatening condition. Prevention and treatment focus on ensuring adequate hydration. Elderly individuals should drink fluids regularly throughout the day, even if not thirsty. Water, fruit juices, broths, and herbal teas are all beneficial. A balanced diet rich in water-rich foods like fruits, vegetables, and soups is crucial. Minimizing exposure to extreme heat and monitoring urine output. Dark yellow or absent urine indicates dehydration, are important preventative measures. Medication review with a physician is essential to address potential dehydration-inducing drugs. Regular health monitoring is vital for those with chronic conditions to proactively manage dehydration risk. 10. The fear of falling. Fear of falling, FOF, is a common anxiety experienced by older adults, characterized by apprehension or worry about falling, even without a history of falls. This fear often stems from feelings of insecurity while moving or navigating their environment. FOF can significantly restrict activity and diminish quality of life, as individuals may avoid physical activity or limit mobility to prevent falls. This anxiety can severely impact self-confidence and independence. Several factors contribute to FOF in older adults. Changes in physical health and fitness, such as decreased vision, hearing, or mobility, can lead to a sense of reduced bodily control. Muscle weakness, joint stiffness, or difficulty moving can foster insecurity and fear of falling. A history of falls can create a strong fear of recurrence, leading to avoidance of physical activity. Age-related declines in balance, exacerbated by slippery surfaces, uneven terrain, or obstacles, increase the risk of falls and heighten anxiety. Cognitive decline or memory problems can lead to forgetfulness about safety precautions, increasing fall risk and fear. A sense of loss of control, particularly when facing health challenges or reduced self-care abilities, can also contribute to FOF. The impact of FOF on the health of older adults is substantial. Reduced physical activity, a common consequence, leads to deconditioning, muscle weakness, and further balance impairment, creating a vicious cycle. Ironically, this avoidance can paradoxically increase the actual risk of falling. FOF also negatively affects mental health, potentially leading to increased anxiety and depression. Social isolation and reduced quality of life are further consequences, as individuals may withdraw from activities and feel a loss of independence. Symptoms of FOF manifest in various ways. Common signs include anxiety and tension when considering movement or physical activity, restriction of activities such as walking, climbing stairs, or going outdoors, cautious physical behavior such as slow walking, avoidance of slippery surfaces, and reliance on assistive devices, and a heightened sense of vulnerability to injury. Prevention and treatment strategies focus on improving balance and strength through gentle exercises like yoga or tai chi, utilizing assistive devices such as canes or walkers, modifying the home environment to remove hazards and improve safety, and seeking psychological support and social engagement. Addressing FOF requires a multifaceted approach that combines physical interventions with psychological support to enhance safety, confidence, and overall well-being. 11. Reduced sensation in the legs. Causes of reduced sensation in the feet. Diabetes. Uncontrolled blood sugar levels can damage nerves, particularly in the feet, leading to diabetic neuropathy. Symptoms include numbness, tingling, and in severe cases, complete loss of sensation. Peripheral nerve damage. Conditions like arthritis, injury, or infection can damage peripheral nerves, reducing sensation. Diseases such as Parkinson's disease can also affect nerve transmission. Venous insufficiency. Reduced blood flow to the feet can cause numbness and heaviness, impacting sensation. Vitamin B12 deficiency. Vitamin B12 is crucial for nerve function. Deficiency can cause numbness or reduced sensation. Medication side effects. Certain medications, including chemotherapy drugs and some neurological medications, can cause peripheral nerve damage and reduced sensation. Natural aging. As we age, nerve function, including sensation, can decline due to reduced sensitivity of nerve receptors. Symptoms of reduced sensation in the feet. Symptoms vary, but may include numbness, tingling, or a pins and needles sensation. Other symptoms can include heaviness, complete loss of sensation in severe cases, difficulty walking, and pain or aching. Impact of reduced sensation in the feet on health. Increased fall risk. Reduced sensation increases the risk of falls, especially in older adults. Reduced mobility. Decreased sensation may lead to reduced physical activity, muscle weakness, and impaired balance. Reduced quality of life. Reduced sensation can lead to dependence, decreased confidence, and social isolation. Mental health risks. Individuals may experience anxiety, depression, or feelings of helplessness. Prevention and treatment of reduced sensation in the feet. Diabetes management. Controlling blood sugar levels is crucial for preventing or minimizing nerve damage. This involves a healthy diet, regular exercise, and regular blood sugar monitoring. Vitamin B12 supplementation. If a deficiency is the cause, supplementation can help. Good sources include meat, fish, eggs, and dairy. Physical therapy. Physical therapy can improve muscle strength and balance, reducing fall risk and improving sensation. Medication management. Consult a doctor to adjust medication or switch to alternatives if medication side effects are contributing. Appropriate footwear. Wear supportive, well-fitting shoes with non-slip soles to reduce fall risk. Regular health checkups. Regular checkups can help detect nerve or circulatory problems early. 12. Adjust your posture. Postural hypotension, or a sudden drop in blood pressure upon standing from a lying or sitting position, is a common cause of imbalance. This occurs because blood hasn't yet fully circulated to the brain, leading to dizziness and lightheadedness. It's particularly prevalent in older adults due to age-related declines in blood pressure regulation. Weakened cardiovascular function, such as from heart failure, reduces the heart's ability to quickly pump blood to the brain when posture changes, increasing the risk of imbalance or fainting. Autonomic nervous system disorders affect the body's ability to adjust blood vessel dilation constriction in response to postural changes, leading to insufficient blood flow to the brain. Dehydration or blood loss, even mild, reduces blood volume and pressure, making postural changes particularly risky. Certain medications, including diuretics, antihypertensives, and vasodilators, can increase the risk of postural hypotension in older adults. Common symptoms experienced during sudden postural changes include dizziness, lightheadedness, blurred or dimming vision, temporary imbalance or falls, palpitations, fatigue, and nausea. These symptoms typically last seconds to minutes but can be prolonged and dangerous in some cases. Potential consequences include a significantly increased risk of falls, leading to fractures and head injuries, particularly in older adults. Postural hypotension can also diminish quality of life due to anxiety, reduced mobility, and decreased physical activity, further increasing the risk of illness. Repeated episodes of insufficient brain blood flow also increase the risk of cardiovascular complications and stroke. Preventive measures and improvements include gradual postural changes, avoiding sudden standing, sitting up for a few minutes before standing, and standing slowly before moving. Maintaining adequate hydration, 1.5 to 2 liters of water daily, unless otherwise advised, is crucial. Limiting alcohol and stimulants, which can cause vasodilation, is also recommended. Eating smaller, more frequent meals helps prevent blood pooling in the digestive system after eating. Medication review with a physician is essential to adjust dosages or switch medications if postural hypotension is a concern. Gentle exercise, such as walking, yoga, and light stretching, improves circulatory function and blood pressure regulation. Compression stockings may also be helpful in reducing blood pooling in the lower extremities. Consult a physician if dizziness or imbalance occurs frequently, if fainting or near-fainting episodes occur, if there are unusual heart rhythms or palpitations with postural changes, or if fatigue significantly impacts daily activities. 13. Cognitive decline. The relationship between cognitive decline and imbalance. Impaired orientation. Individuals with cognitive decline may experience spatial and temporal disorientation, difficulty navigating, increased risk of tripping or bumping into obstacles, and getting lost. Slow information processing, reduced ability to receive and process environmental signals, sound, light, ground incline, etc., leads to delayed responses and an inability to adjust posture in time to prevent falls. Difficulty performing coordinated movements. Actions requiring coordination between multiple brain regions and sensory organs, such as walking while turning the head, changing direction, or turning around, become challenging with cognitive impairment. Lack of awareness of risk. Individuals with cognitive decline often fail to accurately assess danger, e.g., slippery stairs, uneven floors, leading to risky behaviors without precautions. Impaired memory and concentration. Difficulty remembering the location of household items or lack of focus while walking increases the risk of falls. Common types of cognitive decline. Mild cognitive impairment, MCI, an early stage with minimal impact on daily life, but requiring monitoring as it may progress to dementia. Dementia, a more severe condition significantly affecting intellect and self-care abilities, with Alzheimer's disease being the most prevalent type. Common manifestations in older adults with cognitive decline. Forgetfulness, places, people, objects, repetition of words or questions, difficulty planning or performing familiar tasks, disorientation at home or outdoors, inability to recall safety warnings or instructions, and impaired concentration during tasks or while walking. Risks associated with cognitive decline. Falls and injuries. Individuals with cognitive decline have a 2 to 3 times higher risk of falling, with a greater likelihood of severe injuries. Reduced quality of life. Loss of independent mobility necessitates constant supervision. Increased risk of hospitalization and death due to injuries or related complications. Supportive measures and prevention. Regular brain training. Engaging in activities like chess, reading, brain games, and light manual work helps maintain brain function. Maintaining regular physical activity, walking, yoga, and qigong stimulate blood flow to the brain and improve neurological function. A brain-healthy diet, ensuring adequate nutrition and supplementing with omega-3 fatty acids, vitamins B6, B12, and folic acid protects brain cells. Regular health checkups, monitoring blood pressure, diabetes, and cholesterol levels is crucial, as these conditions increase risk of cognitive decline. Creating a safe and easily navigable home environment. Maintaining clear pathways, adequate lighting, and using color-coded room markers aids orientation, providing appropriate supervision while maximizing the individual's independence. When to see a doctor. Older adults exhibiting forgetfulness, disorientation, or unusual behavior, unexplained falls, personality changes, or difficulty managing emotions, or when family members are concerned about their ability to care for themselves. Don't let imbalance disrupt your life. With helpful information and effective preventative measures, you can maintain autonomy and safety in every step. Apply the advice in this video to protect your health, and remember that self-care is the best way to enjoy a healthy, energetic life. Don't forget to subscribe for daily updates on healthy living tips